Meconium ileus in neonate with cystic fibrosis by Silvia Moya Lor. Definition: Meconium ileus is obstruction of the terminal ileum by abnormally tenacious meconium. It most often occurs in neonates with cystic fibrosis. Meconium ileus accounts for up to 33% of neonatal small bowel obstructions. Symptoms include emesis that may be bilious, abdominal distension, and failure to pass meconium in the first several days of life.
Hi, my name is Yahya Ithawi. I am pediatrician and neonatologist, and in the next series, I will be presenting the neonatal topics. So, if you like it, you're welcome to subscribe or press like. In this presentation, I will be talking about Meconium ileus. Now, Meconium ileus occur in neonate, usually caused by obstruction of small bowel, and that obstruction is at the level of the ileum. And the reason for the obstruction is presence of inspissated meconium. Inspissated meconium is a kind of thickened and condensed meconium caused by absorption of the fluid from the bowel lumen. And that results in increased thickening and decreased fluidity, and this causes plugging of small intestine with a thickened, condensed viscid mucus. The Meconium ileus account about 30% of the causes of the intestinal obstruction in neonatal period. And recently, with the wide use of prenatal carrier testing and use of prenatal ultrasound, many cases of Meconium ileus usually detected, which allow prenatal counseling of the parent and finding appropriate plan of management and planning it before delivery. And cystic fibrosis is the most common disorder associated with Meconium ileus.
Applications in medicine. Meconium ileus is most often an early manifestation of cystic fibrosis, which causes gastrointestinal secretions to be extremely viscid and adherent to the intestinal mucosa. Meconium ileus is the presenting clinical manifestation of cystic fibrosis in 10 to 20% of cases. Of infants with Meconium ileus, 80 to 90% have cystic fibrosis.
Meconium is the stool that exists inside a baby's bowels in the womb and also for the first few days after delivery. It's kind of tarry and sticky, it's army green in color, almost black, and a baby doesn't usually have a bowel movement inside of the womb. If they do, then this army greenish stool mixes with amniotic fluid and changes it to some shade of yellowish to green. Research has shown that a baby may naturally have a bowel movement inside of the womb as they near their due date, or especially if they go over it, but sometimes it also happens because of a deprivation in oxygen. So if you're ever at home and you feel like your water broke and the fluid is yellowish to green, definitely let the healthcare provider know about that. And this is something that we take note of, whether the woman came in with her water broken or whether we broke the woman's water inside of the hospital while she was during labor. It's a very important thing to know. Special precautions will be taken at delivery. It won't necessarily change the course of labor and delivery, like meconium doesn't mean that you have to have a C-section, but a respiratory therapist and trained nursing staff will be available at delivery in case the meconium causes issues with breathing for the baby after birth. A lot of people also want to know if their first baby had meconium, if their second or third baby will have meconium too. And it's not genetic, it's very circumstantial. If you have more specific questions about it, talk with your OB provider. And if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.
Pros and cons. Pros. First, it is only seen in a subset of patients with cystic fibrosis. Second, it can be diagnosed by doing prenatal ultrasonography. Cons. First, abdominal distension may also be severe enough to cause respiratory distress. Second, about 50% of cases are complicated by malrotation, intestinal atresia, or perforation. Issue applied in Ecuador. In 1993, the Cystic Fibrosis Foundation was founded in Guayaquil, and since then there have been diagnosed 187 cases, 125 in Quito and 62 in Guayaquil. From those cases, 60% have been neonates, and most of them have had Meconium ileus as a previous disease.
She's 7 weeks today. She has 2 hospitals. She had Meconium ileus when she was born. She's getting her surgery next week. There's one ostomy. Those are her intestines. And she has another one here you can't see, but they were taking her poop out of one bag and refeeding it into her other intestines. So now she's pooping in her diaper. Yay! Say hi. Say hi, Missy. She's the cutest baby ever. Oh, thank you. Oh, say hi. And she has cystic fibrosis. And they're doing a continuous feed, 22 milliliters an hour, and then they're also feeding her stool into her other ostomy at 17.5 an hour. Say bye, YouTube. Say bye.
Conclusion. Meconium ileus is a condition where the content of the baby's bowel or meconium is extremely sticky and causes the bowel to be blocked at birth. In most cases, the bowel itself is complete and intact, but it is just the inside that is blocked.
I'm Alan Danneman. I'm a pediatric radiologist at the Hospital for Sick Children in Toronto, and the topic that I'm going to talk about this afternoon is congenital bowel obstruction in neonates. The modalities that we use in the neonatal period in order to diagnose and manage congenital bowel obstruction are fairly simple and include plain radiographs, contrast studies of the upper and lower GI tract, and occasionally sonography. On the plain radiographs, there are 2 major things that one wants to evaluate. The first is the gas pattern, and the second is calcification. The gas pattern involves evaluating the intraluminal intestinal gas pattern, whether there's any free gas, intramural gas, or portal venous gas. In the neonate, the abdominal radiograph will show a bowel gas pattern that is distributed throughout the small and the large bowel. Although the amount of gas may suggest that there is an obstruction, the pattern of distension of bowel is a clue to normality. When one has a pattern, as one sees on the left here, where the bubbles of gas are faceted and fitting to one another,